Well, thank you. Any questions? If not, Ash, state your name for the record, who you're with, and your position on the bill, and you may begin.
Sounds good. Thank you. My name is Ash Hall. I'm with the ACLU of Texas, representing them and myself here against the bill. So basically what this bill does, right, is if a plan covers any gender-affirming care, even for a single enrollee in a program, the insurer must pay for all possible adverse consequences related to such care, even if the person who received that care was not enrolled in the program at the time they received it. Because the potential cost of this rule is unknowable and limitless, we feel that SB1257 would discourage health insurance programs from providing coverage to transgender Texans for any kind of gender-affirming care, including mental health, counseling, or therapy. This could devastate the lives and livelihoods of transgender Texans, harm the competitiveness of Texas businesses with trans employees, and drive up the already far too high risk of suicide among trans youth and adults. And because this bill cruelly targets one group of Texans and seeks to strip away their health insurance, it is deeply discriminatory, unconstitutional, and at odds with state and federal law. Worth noting that while trans youth and adults face the same mental health crises as all Texans, they also face heightened rates of anxiety, depression, and suicidal ideation due primarily to discrimination against them. It is particularly interesting to me that in 2024, 90% of LGBTQIA+ youth said that their mental well-being was negatively impacted by politics. And so this legislature has been part of that, and now we are looking at a bill that would then turn around and deprive them of getting mental health care. And I can't really think of anything more cruel to do to youth than that. So a few things that we believe. We think that Texas should expand instead of diminishing access to health care, especially given that we are looking at a shortage of 1,043 psychiatrists by 2032. We are not okay with the fact that this bill curtails critical medical care for trans adults and youth alike. And we also think it's worth noting that in addition to being unconstitutional, that because of the liabilities that insurance companies could face due to this bill, it actually could drive up the cost of health insurance for all Texans.
Thank you, Ash. Just a quick follow-up. I don't think the bill denies mental health care. And maybe I'm wrong, Senator Hughes, am I wrong on that? It says if you have as coverage, you pay for a transition, then you must pay for all care thereafter, including if there is a reverse transaction. I mean, if you want the long term, you're going to do the health care. Am I right on that?
No, thank you, Madam Chair. And that's right.
It's been a long time. It's been since this morning that we laid the bill out.
No, thank you, Madam Chair. That's right. And there are multiple parts to the bill. And so if coverage is provided to pay for the transition, then coverage must be provided for folks that wish to detransition, but also folks who, again, have other health needs as a result of the transition. That's also got to be paid for. That's also covered.
Okay.
It's definitely covered.
I just wanted to make sure on that because I may have misread that. And so it encompasses the entire scope of caring. So, but I appreciate your testimony today. I just want to make sure that I had not misread the bill.
Thank you. You're correct. Thank you, Madam Chair.
Senator Cook.
I just want to clarify. So I don't think, were you saying that the bill does it, or you're thinking people will be discouraged from even providing like super basic care to people because then they'll be on the hook?
Correct.
Say that again, Senator Cook.
It's like the people won't want to provide any care to anybody who's in gender transition or non-binary, because then there'll be those insurance providers would be on the hook for any care in the future related to.
Yeah. Obviously.
Yeah.
Right, that's our issue with it. We actually are pro, expanding healthcare for everybody, but the way that this bill is written, the way that the definition for gender transition procedure or treatment includes counseling and therapy, that means if insurance companies don't want to be on the hook, then they would need to stop providing all of that care, including the mental health components, and that is deeply problematic.
Okay. All right, thank you. Thank you for the clarification. Thank you for staying so late tonight. Is there anyone else wishing to testify on committee substitute to Senate Bill 1257. We did have, I'm sorry, just